Hello, everyone. My name is Andre Meloche, and welcome to Cerberus at the Improv, episode from July 29, 2025. I am joined by my co-host Timothy Knight. How are you, Timothy, today?
It's a gorgeous day out here in southwestern BC, and I'm actually excited about today's topic. I think what we're going to talk about today is unique and takes power away from those who would abuse it and gives it back to the people themselves. So I'm excited to see something that does that.
So we will talk about the People's Parliament, and we are welcoming a co-host, a guest, Mr. Doug Bebb, who is a well-known figure in the People's Party of Canada, but also in British Columbia in many domains. How are you, Mr. Bebb?
Good. I'm very pleased to be here. I can tell you a bit about myself, if that might help.
Yes, of
Yes.
course.
Yeah, okay. Well, I'm a semi-retired, almost retired mechanical engineer with an MBA, both from British Columbia. I was raised in the Lower Mainland and was kind of agnostic when it came to politics until about 2018. And I jumped in, been with the People's Party ever since, trying to make some useful change in this country and keep it together. So when I was asked to participate in the People's Parliament as a commissioner, I jumped on the opportunity, and I think the episode went quite well.
So that's what we will talk about today. The main topic will be on Cerberus and the Improv, the first commission that you attended. I was there too, and Payment Askari was the organizer. Jason Dahl was the moderator, and we were having Dr. Anna Sylwestrowicz, who recently testified before Commissioner Bebb, Meloche, and Askari on the abuse enabled by the BC Mental Act. So where does the People's Parliament go from here? That will be maybe some question that we can ask you. And can Canadians take back control of legislation from accountable elites? So could you introduce the idea of the People's Parliament, Doug? And Tim, go ahead. You can always jump in anytime.
Maybe we should move to the next slide for the definition. Oh, back
So
one.
No,
sorry.
The purpose statement.
The purpose statement. Okay, let's go with
Yeah.
the purpose statement.
So we had, a preliminary Zoom call this morning. It wasn't Zoom, it was on, I think, Google Meet. But anyways, the question arose as to what the purpose of the commission is. And the purpose is to expose the reason or the causes behind the problems in law that we have that are causing people's lives to be affected. And in large measure, I think corporatism, and that's not the same as capitalism. Capitalism is an economic model. Corporatism is controlled by those entities for their advantage. And there's been more and more of this recently. It's all around the world. And the lobbying is out of control. They're actually writing the laws, a lot of these corporate interests. There's probably some graft or some influence peddling and bribery behind the scenes. And they end up writing these laws, and then the legislators pass these laws without even reading them in many cases. Sometimes on Christmas Eve when they're not even, in the forum. And so the problem is that there's a disconnect between the problems that people have in their lives, the reasons for them, and we're trying to address this by revealing the deficiencies in the law themselves and how they got there and what we can do to make changes.
Tim, any comments?
I'm curious to know about what brought the particular group of you together, and how do you recognizing that there is this disconnect between the lawmakers and those on the receiving end of bad laws, what brought you together to decide that you wanted to put together an organization like the People's Parliament? How did you come to that decision?
Well, Well, I think this whole problem is well understood and discussed in certain circles. The reason for it was well explained by Professor Bruce Pardy in the National Citizens Inquiry testimony, where he laid out three sort of legs to this triangle. One is that the parliaments are able to delegate. First of all, they have this discretion to do whatever they want based upon the legitimacy they receive, when they're elected. But then they don't actually enact all these laws. What they do is they delegate the authority to the back office, so we call it, the permanent administration, under what's called the regulation. So, for example, in Canada, federally, we have the Food and Drug Act, and then subsequent to that is written another set of stuff called the Food and Drugs Regulation, and the amount of delegation that goes into that is excessive, and so we end up with the back office writing all kinds of regulations pursuant to the Food and Drug Act. And this is where the lobbyists get in. They basically formulate things in their interest, and they have force of law, and they can do it whatever they want without ever going back to Parliament or the provincial legislature again. So these problems are well known and understood, and yet people don't really know why it is. So if we could come to some reasonable distillation or a simplified version of these problems in a short document with underlying testimony from experts, it might serve to help to inform the public as to why these things are happening in the first place. So that was the idea. And actually, I wasn't the originator here. I was roped in, and gladly so. So yeah,
roped in.
Yeah.
Our destiny chooses us sometimes,
I guess. Yeah. Well, it's not a destiny that I object to. I mean, it's a necessary thing.
Yeah.
And so we'll see where it goes. I mean, the first episode was successful, I'm quite sure. I'd recommend people watching it. We can go over the highlights here today, and hopefully we'll be able to address other aberrant aspects of the law that have been put into place, with the support and to the advantage of these interested third parties. And it also touches on government corruption very much.
So when you and Andre and other commissioners put on an episode with a what's the right phrase? SME, word escapes me now.
It's this.
Is it SME?
Subject matter expert.
Thank you. So when
usually it is me who always forget it. So.
And today it's my turn. So when you put on an episode, how do you choose what you want to talk about, and how do you find a subject matter expert that will help you to unpack the topic effectively?
Well, I don't think there's any lack of problems, in society with the laws and people that take issue with them. I mean, our initial segment here on the BC Medical Health Act, I think it was a bit difficult for Payman to arrange a subject matter expert, but it was a very professional shoot, and I think now it's going to be easier to get them. I mean, like I say, there's plenty of issues to take up. Hopefully we get to the point where we'll have to turn some down, because we need to have things that are actually relevant and useful to the majority of people, right? There's all kinds of esoteric laws on the books that really don't affect many people, and we can't do them all. I mean, you look at the code in the US or in Canada, it's volumes, Some of them are good, some of them are bad, but we'll have to have people bring things to us that they want to have, basically provide a window to the public on bad legislation and potential corrective options. So that's the idea. This morning we had a discussion around how that was going to happen, and the idea was maybe we'd evaluate certain SMEs and the topics they want to discuss, and we'll have a vote and see which ones make the cut, So
First of all, Doug, thank you for using the word professional. Usually, I tease Tim with that. Maybe I can just add something to what you were saying. The first subject matter expert, we were not sure where we were going at first. I think there was a vacuum after the election at the end of April for many people who were involved politically. And we arrived at the point where we were asking what could be our political engagement. And Payment had many interviews, and when he started to suggest to not amend but write a constitution, we slowly end up into in a place where we were saying, okay, we have to tackle subject that affect the day-to-day life of people. And then Payment suggests Dr. Anna Sylwestrowicz, because he interviewed her 2 times. She was she's very skilled, so 30 years in general practice, and she had problems, personal problems, so she was ready to testify. That was the first thing. So choosing the first subject matter expert was difficult at first, and then we had to read the law, read the BC Mental Act. We had to prepare questions. Doug arrived and compared the BC Mental Act with the Canada Health Act. That helped a lot, and the idea was to focus on the testimony of a subject matter expert and ask precise questions about the Mental Act. So we tried to stay focused. I think the episode was interesting, and it was practically a 3 hours episode. So it means that the person, Dr. Sylwestrowicz, was ready to talk about this subject.
I watched the episode and was taking notes on the side, and one of the things that really struck me with Doug and Andre, and I'm sharing this with the audience now, is it was evident from the way they shared and asked questions of Dr. Anna that they had put in a considerable amount of time in research and preparation. And I find that where, say, for ourselves, we intentionally improv. But what Doug and Andre and others who will participate in the People's Parliament are doing is putting in a significant amount of research into not merely the law, but its implications. As Doug mentioned a bit earlier, the bureaucratic layer and the problems where regulations are turned into policy in that layer. So, and how easily they are influenced by lobby groups and external agents. So it takes research to dig through to find all of that. And then when they're asking questions of the subject matter expert, the subject matter expert is able to respond to those questions in a manner that the general public may not have seen before. And I think that in that the word Doug used was he'd mentioned in the earlier conversation. I don't like the word educate. I prefer the word inform, and that really resonated with me. And so I find that what Andre and Doug, or future commissioners, are able to do is to bring out that informing conversation from the subject matter expert. So I found that very, very useful as a viewer, because there were things that I learned that I was not aware of.
I personally, I put maybe 5, 6, 7 hours just reading the act and preparing the question. But Doug was mentioning this morning, and maybe that's the question I have, Doug. How many hours did you put up? Because you mentioned in many emails that you put up, you read the act many times, and you were very well prepared. So it's a big task. You've put a lot of times and.
Yeah, I'm a bit of a details guy, and I never get things right the first time, so I got to go back and reread and try to distill things down. But the research is done. It's not me. It is, I would say, the best example I found was about a 400-page doctoral thesis on the underlying structure and problems of this act. And there's a history to it. This particular act dates back to the 1970s, I think. It's an old act. And like with the problems we have federally, the structure was ripe for abuse. The whole Canadian structure, the political structure, the Westminster structure we have here was always available to be abused by actors that don't have the interest of the public at heart to serve themselves. So this is always in place. And it was not till more recently that we had these bad actors arrive on the scene in Parliament that ended up abusing these existing laws and creating new ones to facilitate their shenanigans. And the same thing existed with this BC Medical Health Act. It's been around for a long time. And, I mentioned during that session there that reminded me of a 1975 movie that was called One Flew Over the Cuckoo's Nest. And if you haven't seen that, you might want to watch it, because they're talking about forced medication, electroshock therapy, all of these things that we thought were gone. And yet they're occurring, in Victoria and elsewhere in British Columbia. And the consensus is that British Columbia is the worst offender among the Canadian provinces. Of course, health being a provincial prerogative.
We have Doug. We have a question, and it's our dear friend Pamela Askari. Are you worried Canadians may have completely given up on politics?
Well, they better not have. I mean, there's no other way.
Considering the BC Mental Act, maybe you're right.
Well, maybe we'll all be in the gulag, but the only other option here besides political change is a revolution. That's something I want to avoid if we can.
Yeah.
Well, there was a comment from Sue Killen Dyer when she was referring to the MPs. They pass the law, they don't read the bill, but they get the briefing notes. You read the Mental Act, I read the Mental Act, and it was a very dry document. I'm not a psychiatrist, even if I study the law. Some of the philosopher like Michel Foucault, when Doug sent this thesis, 356 page, I think, the table of content and the bibliography, I was recognizing all the work of Foucault. So the work is there from intellectual, but MPs, they are not concerned, because I think it's not a subject that is sexy or that will appeal to Canadian. How do you feel about having people in Parliament not being aware of the bills they're voting on?
Well, maybe it's better that way. I don't think many of them are qualified to even discuss the matter. I mean, they vote along party lines. They don't have, they don't put in the time or the effort to read these things. I mean, maybe they shouldn't be passed at all. I think one of the more interesting things that Dr. Anna Sylwestrowicz said during our commission inquiry was that psychiatry is the least, not documented, but the least supported by evidence, especially of all the medical specialties. And so, what this boils down to is very much opinion. And we can get into details now or later on. But the idea that people should be, forcibly confined and medicated against their will, without consent, on the basis of the opinion of a nurse practitioner, is quite frightening. Lots of people don't really care much about the mentally ill because they're kind of a subgroup that's ostracized. And yet, when this begins to happen to people who aren't mentally ill and ultimately become diagnosed as mentally ill on the basis of side effects of the very drugs that are prescribed to treat them, this is the problem that extends beyond the mentally ill and possibly affects the population at large. And so I think it should be of interest, even if you're not subject to it yourself. It's a risk that we should look at and say, well, why are they allowed to do this?
Tim, any comment?
Now I'm looking for the echo that Canuck Saram mentioned. So my thoughts on where Doug is going is It's
Well,
this is in our public perception, we're often talking about, or we think we're talking about, this undisciplined, unfocused, mentally disabled individual who's suffering from, some type of psychotic event or whatnot. And so we think that we need to have some type of control measure to prevent them from causing themselves harm or causing someone else's harm. And that's the public perception. But what I caught from listening to yourself and Doug and Dr. Anna was normal, healthy human beings are being roped into forced injections, and even at risk of losing their children if they do not comply. And these are otherwise healthy men and women. So what I find startling is that I wasn't aware that it is as problematic as it is. She mentioned that the number of people in BC who are on the wrong end of the abuse of the Mental Health Act is 6,000 people, and that it's actually higher than the entire population of the United States equivalent set of those under forced injection principles. And so I'm curious what Doug thinks about how do we get over that? How do we find these people who are being abused when the entire system, the bureaucratic layer, seems hell bent on preventing them from becoming a public knowledge?
Yeah, if we're going to talk about details, maybe we should move on to some slides that might make these sort of relationships clear.
Sure.
Yeah.
You want to bring the problem statement, maybe?
We could, yeah. No, the initial purpose of this was to talk about the inquiry, the commission,
Yes.
the people's
Exactly.
parliament.
But one thing that Dr. Sylwestrowicz mentioned was during the commission, she said we're all mentally ill according to the government. And when Doug is mentioning the gulag, a way to censor somebody who's opposing the narrative is to attack them like this. And what shocked me, and we will show maybe the flow chart a little bit later, was that we can all be subject to that. It's very easy. She was saying in the commission, for example, the police can arrive at your house and they have a warrant, they arrest you, they bring you to a hospital, and the psychiatrist or the nurse practitioner will force an injection on you, and after that you're stuck for she was saying it's more safe to go to jail than to go to a hospital in BC. So maybe that's something that is concerning. We're not aware that they have this level of power over us, even if we consider ourselves normal person.
No, a warrant's not required.
That's incredible. And one of the things that I see that the People's Parliament over time will be to discover similar types of abuses across a variety of different laws that have a negative effect on our culture.
Exactly.
Yeah,
exactly.
Peter would have a comment here. He's been through the process.
Yeah.
And that's
Exactly, and
my
you see,
reading of it. That's my reading of it as well. A nurse practitioner can initiate a detention with the approval of this director of the building for a period of 48 hours. And that's probably what happened to Peter. After that, if they get a needle in you and it begins to have adverse consequences in terms of behavior, then you end up exhibiting the symptoms that they said you had in the first place that might not have had. So let's maybe move on to the next slide.
Maybe you want to bring the mental health flow chart.
No, the next one.
Yes.
Yeah, the problem statement. So I tried to distill down, as kind of the opening portion of the report we're going to have to write here about what the problems are. And I might just read this. So the mentally ill are not a group of concern. And so they're living sort of parallel lives. and not thought about much by the majority of society. It makes them easy targets for unscrupulous actors. And even more so when the government gets involved and cooperates, and actually I'd use the term collaborates with pharma. And so pharma's always looking for, for patients to expand their market. And they appear to have struck upon a scheme to capture the mentally ill as lifelong patients. And I think that's pretty well substantiated by the testimony that Anna Sylwestrowicz gave us. And they're aggressively pushing dangerous drugs. One of them that is used in BC is called this depot abilify maintainer. And the depot is, I think, referring to a long-lasting thing. It could be a month or longer, slow release sort of thing. So you get one shot and you're kind of like changed for a month at least. And so the problem is that the diagnosis that was initially, correct. The diagnosis that was initially claimed ends up being, imposed on the individual as a result of side effects of these very drugs that they're claiming to treat. And there's more going on there. So persons who are not mentally ill can then appear to be mentally ill after treatment. And this creates the ongoing mistaken diagnoses we see. And then I think the most disturbing aspect of this mental health act is that they're able to force detentions and injections of these drugs without the consent of the patient. And the threshold for all this is very low. And it's once you're involved in this process, it's very difficult to escape. Not to escape, but to exit the program. Escape has a different meaning. Because then they can issue a warrant, and doesn't even come from a court. And the director of the building you're housed in can issue a warrant for your return. And so now their medical tyranny, I guess we should call it, is transgressing into the area that used to be controlled by the courts. So there's all kinds of issues going on with this. And the other thing that I think we could talk about here on this problem statement is what actually constitutes a mental illness. I mean, some of them are likely legitimate. Other ones, like wayward teenagers acting out, old people with dementia, all of these things can be classified as mental illness by, unscrupulous or at least inattentive medical personnel. And then once you're on this program, it's hard to get out, and they basically ruin your life. So it can affect people that really aren't mentally ill. And it's a very good pathway to expand the market for these antipsychotic drugs that are being pushed by pharma and supported by the lobbying they do to our federal and provincial governments. So
one thing I've noticed when we were in the commission is, and I mentioned that a couple of times, the DSM-5, which is Diagnosis and Statistical Manual of Mental Disorder. And I read this document for many years. And I've noticed that since 2019, I had a version of 2019. And I, for the purpose of the commission, I downloaded the new version in 2023. And there was an increase of 300 pages in the document, meaning that they have more and more what they call mental disorder. And they try to pinpoint every behavior like a mental disorder that will need medication. And I think that Dr. Sylwestrowicz pointed out that it is increasing. They're increasing their grip on what they call mental health. And I think Doug mentioned also, we had some question about how you can detain people very easily. And this is disturbing. You can arrive and somebody will just call the police on you. You had an aggressive behavior, or they say that you had an aggressive behavior, and they can arrive and they will detain you, and they can medicate you, and after that you get into a cycle. For me, it was not new, but when I read the Mental Act, it is written black on white. This is quite shocking because you see the amount of power that the institution have over the right of citizens.
Yeah, the strange thing is, though, this legislation has been on the books for decades.
Yeah.
And yet the abuse didn't start until more recently. And it started seemingly coincident with a very, very small study that was like only, I think Anna said 33 people finished it, and a lot of them died. After which point, these antipsychotics were prescribed in large volume. And so, the idea that this one class of drug, not one particular drug, but one class of drug, is prescribed for a whole range of these DSM, defined diseases, or which really aren't diseases anyways. And so they're being probably prescribed off label because there's no supporting study to justify their administration of these drugs for all these various things. And then it just continues in a vicious circle. These people end up, if they're even discharged, they end up at home. People come to their homes, they're forcibly injected. If they don't do it, they coerce them. Particularly women who are in public housing or have children. The government threatens to take away their children, to impede their ability to live in public housing, and so they're kind of coerced into a continuing cycle to be a pharma client for life. And there needs to be a way out. What are you solving? You take drug addicts and you capture them, and then you change the drug that they're on, but they're still on drugs. It's not treatment, and it's not an effective public policy, and it's not a good use of public funds.
Well, we saw, what we saw with the COVID mandate and the forced vaccination, quote unquote, it was starting to be systematic. And I think, like you mentioned, Doug, many people, they're not necessarily suffering from mental illness, but they are in a depression. They have low income, like you say, split family, mother who don't, the father went away. They're stuck with children, and they're using. Dr. Sylwestrowicz was saying that they're using blackmail often to force injection people, and this is quite revolting because you see that those people are vulnerable. Not necessarily mentally ill, but in a very difficult, maybe economic situation. And they're taking advantage of that to medicate them. And this is, we think that you always think that it's never you, that it will never happen to you. But if you have an episode of depression, I did 2 burnout in 2000, 2002. And I remember at the time, the doctor that I was seeing, she wanted to put me on antidepressant. And I said no. And she said, okay, we will monitor you. And I said no for about 6 months. And after that, I recovered slowly. But the burnout was due to overwork or whatever would be the reason. But it's very easy to fall in this, what I call death trap of mental medication. So.
Yeah. And so how many more people are on medication in America and in Canada and in the entire West these days? And what has it done to advance the cause of health, or mental health for that matter? I mean, we're a heavily medicated society, and it doesn't really seem to be helping, does it?
Right. Yeah. So, and that leans towards what are we going to do about these, which is always the question, isn't it? You mentioned with the People's Parliament that you're going to be producing a report after these investigations and these commissions. What will that report look like, and who is the audience?
Well, the audience is going to be, I would hope anyways, people that have difficulty connecting their circumstances to the law that's causing the problems. And, it has to be a simplified thing. Maybe we should bring up that flow chart and just have a look at the thing. We can talk about this stuff, forever. And, a picture's worth 1,000 words. So the way this is constructed, pharma is sort of at the center of all this. We have the actors here. I'm not sure if you guys can see the pointer. I probably can't. It's my pointer. But on the left-hand side, you've got the patient, and you have this director of a designated facility, which is a thing that exists in the Act, which is really just the manager of the building, as far as I can tell. And so all it takes to get caught up in this vicious loop is a referral from a nurse practitioner or a physician, which is then approved by this director, and you're in the program. And they can keep you from 48 hours, and apparently they can inject you with these drugs during that period of time. After which, if a physician signs, another form, a second form, they can keep you for weeks, months, and even your lifetime. So this is an extensible admission that if impacts all of your daily life, car insurance, childcare, all these things end up going down the drain as a result of a very loose admission policy that really takes, a diagnosis by a nurse practitioner who really has no expertise in the matter anyways. And, this director who is probably looking to fill beds because he's got a quota to meet that the government gave him, right? And then, once they get out, if they do get released from detention, on the top of this thing, there's these outpatient staff who apparently load backpacks up on the pay, on the paid salaries by pharma, who then go around the community with these injections and get you in your house. And if you don't comply, then they can bring you back in. They can call the police, warrants issued for your arrest if you try to avoid it. And so pharma is providing inducements to physicians and nurses. Some of this is very undisclosed. I mean, apparently there's this sunshine legislation in the States that requires doctors to disclose any inducements they get from pharma that doesn't exist in Canada. So they're influencing it that way. They are lobbying both forms of government, and that is a bit more transparent because there's a registry both federally and provincially of all lobby activity. Now, whether or not it all gets reported is another thing. And here's another issue. This is kind of the structure, the way it's laid out in law. But apparently even this isn't being adhered to. Apparently there's been admissions with forms that weren't properly filled out. There's been an ombudsman investigate this, and apparently like a very small percentage of the paperwork is completed. And so the whole thing really looks like, an effort by pharma to capture a group of people that are ill positioned to defend themselves and turn them into, continual wards of the state and a continual bottom line revenue for pharma. And so the collusion between pharma and governments and physicians needs to be looked at carefully, and we'll probably have a little bit to say about each of these sorts of connecting lines. And then they have to be interrupted. There has to be not just a breakdown of this influence that's exerted over the medical system, but there has to be some look at, more efficient or effective ways to escape from this thing so you don't end up, locked into this vicious cycle for your entire life at expense to the taxpayer, at the expense of your future years. And so here we have, the potential for malfeasance, for collusion.
One thing, maybe to complete what Doug just said, the report is supposed to be short with some recommendation, and one, for example, recommendation was to have a lawyer that would assist the patient at any time. So you are a lawyer or somebody who is designated to help them take decision and maybe not be medicated within 72 hours, because it seems that the process is quite fast and they are eager to medicate somebody who's considered aggressive or delusional. So I think the report will be released, so it has to be short, easy to understand, with some recommendation. And Doug was mentioning something, electroconvulsive therapy, which is electroshock. When you receive a treatment, I was shocked when I asked the question to Dr. Sylwestrowicz. I said, what was the frequency of the electroshock, or what they call electroconvulsive therapy? And she said 12 session. I said, what, on a scale of 1 year? No, she said in 2 weeks. So in 2 weeks, and she was saying it is in United Nations they're considering this torture, and they have the right to do it. So you can imagine you have this type of session, and they are coercing some people. You have to go back and to have your electroconvulsive therapy, which I call torture or electroshock. They're forcing you to have it 1 time per month. And when you discover this, you ask yourself, wait. As a person who already had 1 depression, I tell myself, maybe I was very close to something like this, and I was not aware of that.
Well, there's one more thing to add here. It's not just involuntary detention, as shown in the lower left-hand side, that is approved by the director of the facility. It's also deemed consent or involuntary consent. So normally you have to consent to a treatment. Your doctor will recommend something. You say yes, you say no. Here, this right is removed, so they can forcibly inject you against your will on the basis of a nurse practitioner's referral and the approval of an unmedically qualified director of the institution.
So injecting you against your will, is that not a Nuremberg problem?
Well, it should be, and it was, incidentally, this whole act, it was existing, within the time period covered by the Nuremberg Act, and it wasn't a problem until it became abused, probably with the intervention of pharmaceutical companies. But this idea of removing voluntary consent, right, is really problematic, particularly for people that aren't mentally ill. They get caught up in this program, and they end up exhibiting symptoms as a result of the treatment.
Right.
And, they may well have capacity, compos mentis capacity, to refuse treatment, but it's denied them. So, in the States, apparently it takes court orders, it takes, kind of a finding of incapacity to strip people of their right to refuse treatment. And here we don't have that. I mean, it's a simple procedure with a nurse practitioner and some building director, and the next thing you know, they got a needle in you. It seems way too quick, and without checks and balances or safeguards. And so, we have 2 things here on the left. One's the next of kin, right? And the courts that really have no say in the matter up front, and maybe they should. And there's other things, like disclosure of inducements provided to physicians. On the right-hand side here, we've got pharma funding studies, which are sloppily done. According to Anna, they're ghost written. They're not specific to all these various things that appear in the DSM anyways. So if all you have is a hammer, everything looks like a nail.
Yeah.
And we're looking at a whole range of panoply of potential ailments or mental illnesses, and some of them really aren't even illnesses at all, that are all being dealt with by these antipsychotic, and depot abilify maintainer type of drugs, right? So, and this nurse practitioner who refers this patient, based on some interaction with the patient, really is not in a position to do that workup, that proper medical workup, in order to determine whether or not they're mentally ill in the first place. The whole thing seems insane to me. And I'm kind of glad it was brought up by Anna, because, it actually, at first I thought, well, okay, this is, a provincial matter. I got involved in federal politics. It's a little too provincial. But here again, we have another example of, corporatism in pharma affecting laws. And, it's at the provincial level. And if we can address the matter here, then maybe there's federal follow-ons we can do. But again, this comes down to, breakdown in government structure, governance structure, and law writing to the benefit of special interest groups, in this case, pharma, and to the detriment of the public purse and of the patients who are supposed to be treated. What are they treating them for? I mean, what are they doing to these people? by injecting them with expensive drugs the rest of their lives that probably aren't even effective and cause dangerous side effects. It's not sensible. Anyway.
No, that's very good. That's very good. I'm eager to see what the People's Parliament does with this particular information, and inviting you to come onto the show today, which in my mind was more to talk about the organizational structure of the People's Parliament, and to promote that our viewers and other viewers participate as watchers and become informed. But also I see that we have an opportunity to summarize, right, the work that you've all done in the last couple of weeks, and to present that with our existing audience. And I find this very interesting because what the 2.5 hour conversation you all had, with the inquiry with Dr. Anna, you're synthesizing down into a few minutes that the average person can grasp. And I think that in large part is what's missing between government and the regular citizen, is that government and government agencies intentionally obfuscate language, right? And you're saying these things in plain English.
They do. And political pressure to change things has to have some weight behind it, some numbers of people that are interested in having this happen, right? And so it seems to me, with this doctoral thesis, with the discussions with Health Canada, with all the stuff that Anna's gone through with the colleges of physicians and surgeons, that this stuff is all taking place, in the back room. And until people get, aware and informed in these things and how it might affect them, there's not going to be that mass or weight of people that object to it, to force these politicians to craft better law. And that would be the next step. I think somehow we need to have an advocacy group, that spins off of this commission to force these issues into the public consciousness and get the attention of politicians.
And we honestly, when we had a meeting today, and we were discussing about the outcome, how can we influence MPs and MLA, because the idea is to be able to change the legislation, but do we have any mechanism? The idea of the report, or the idea of the commission, or the People's Parliament, is to bring people with day-to-day life problem, and how we can help them understand the context. That was maybe what Dr. Sylwestrowicz did. She knew very well the context. She was able to expose it. We were able to ask precise questions and have, I would say, a better understanding of the problem with the legislation. So maybe we will have to reach to the public so they can come with problems that affect their life, and based on the law that are deficient, how can we change them?
I'm interested to know how many members of Parliament or members of the legislation are aware that these bureaucratic policies are the result of laws that they signed their name to. And if in your approach to the public might not be go to your member of Parliament or your member of your legislature and say, this is what's happening, you signed on to this, is this what you want? Because I don't, right? So that the voter can impact the member of Parliament or the legislature and say, we want these laws opened up again and amended. We want protections for citizens.
We can push this as far as perhaps drafting amendments to law, and then present them, to, well, it'd have to become, official party policy for one of these sitting parties, in this case in the BC legislature, or perhaps as a private member's bill to get this thing onto the floor, and into at least into the record. But this, it's a complex problem, but I think there's various ways that these problematic chains of influence can be interrupted. And, the status quo is not going to like it, and they're well funded.
Yes.
That doesn't mean we shouldn't try.
Yes. Yeah, they are remarkably well funded. Yeah,
Well,
this what Doug ran it saying in BC was $52 million a year just for this one drug regimen.
Yeah, and I think another equivalent amount went into the Narcan thing. So now you got these drugs and more drugs and more drugs. Anna referred to it, I think, as something called a prescription cascade, or
Right.
cascade, anyways.
Yeah.
Additional drugs, and you got all these, you're on all these drugs. Nobody has any idea what the cross side effects are. Drug interactions. More and more drugs, I don't think really is the answer.
Right.
You got a homeless problem, you got a drug addiction problem, you got economic problems with people losing their jobs, and then prescribing these dangerous psychoactive or psycho like this Abilify drugs is not much of an answer.
Yeah. And these drugs they came with lists of side effects published by the FDA and the Canadian Health Canada. And despite these warnings of significant psychiatric side effects, they're still using they're still using these injections.
I believe she said there's several hundred lawsuits against all of them, for damages. Not all drugs have immunity.
Mm-hmm.
Well, that's one interesting point what you're mentioning, though, because we can maybe compare what would be the People's Parliament with the actual Parliament of Canada, what we're trying to do, because if there are several trial, if they are sued, there will be compensation, and I would say, how will we link the two? Maybe the question for you, Tim, and a question for Doug: how we can link the People's Parliament with those topic and recommendation, and the real Parliament who is supposed to vote the law that we live in? Will we be able to influence them?
I think what Doug mentioned a bit ago with that there may be other organizations that rise up out of this information and say, we can act on these things. So you're going to publish a report that will give recommendations, possibly even, like suggested amendment language itself and whatnot, and that there might be other organizations that come out of the woodwork and say, that's what we've been looking for. You have synthesized what we need. And then so other members of the community will bring what they're good at, if they right, so lobbying from the grassroots, these elements, and that they can make these presentations to their MPs or to their doctors even, right? And so that you synthesizing the information the way that you have in this particular episode, and the way that the People's Parliament appears to be able to do, puts knowledge in the people's language in a smaller form. Right, you're not producing a 4,000-page document. You're producing a shorter report that is specifically designed for the average citizen to read and absorb and understand, to be motivated by, and to do something about, because you've given them tools.
Right? No, I think these issues are all pretty well known, within the specialties and within medicine in general. I'm sure there's a lot of practitioners, doctors and nurses, who object to this thing, but are cowed into silence because they're basically government employees and they can't speak up without risk of losing their jobs or whatever. And they're all forcibly injected too, by the way, with mRNA. They can't get away from that, it seems. But I think a reasonable function would be to influence the public consciousness, because all these things are well known behind the scenes. They're all making a buck on it. The money is flowing. And they're not going to change unless there's external pressure applied. And the only way that's going to happen is through, public participation and objection, basically. And when people find out that their kids might be caught up in the system and their lives ruined, by the word of a nurse practitioner and a possibly compromised director of an institution, and they're going to be upset. I think they should be upset.
Well, I don't know about you, but if we go back with the COVID mandate era, or I would say experience, I saw many parents who either comply with the government, not only with the vaccination or the injection, but the fact that they were forcing children to study remote. They could not see each other. Me, I'm more concerned about the public behavior because we can arrive with a good recommendation. I do agree with Doug on that. I think there's a part of education, but also I was thinking about how we can attract them and make them aware of what is happening because the information is there. The British Mental Act, okay, it's a dry document, but it is 28 pages. If you read it carefully and if you take your time, you will understand exactly what we were doing. Then after that, are we able to ask real question toward? I think in Canada we are in very big problem with the power grab of pharmaceutical company. They're lobbying everywhere, and even practitioners, doctors are afraid to speak. They were afraid to speak, and they were told to shut up during the COVID mandate in Quebec. It was awful. Nobody believes le Collège des médecins du Québec anymore, and they never changed their strategy. Even 5 years after the first psychodrama, they're continuing to force people to have injection in Quebec. I'm astonished how people are not waking up, and they're supposed to be educated people, doctors, nurses. They're supposed to be educated people. They're supposed to be able to ask questions. They are not. I'm still concerned, and that's why maybe the People's Parliament, we try to wake up the population, but you have a part of the society that is more educated, but they're still, in my opinion, they're still brainwashed. How will we affect them?
A lot of people think this whole mRNA injection thing is a thing of the past, and apparently it's not. I read an article. I read an article this morning, and I think it was the Globe and Mail, that insists upon up-to-date COVID vaccinations as a precondition to employment.
Yeah.
Yeah. So if your kid is in literature or journalism, they're not going to get a job unless they're vaccinated.
They're finishing building a Moderna factory in Quebec now, and they will subsidize the factory up to $300 million provincial funding, because it is a provincial prerogative. Healthcare is a provincial prerogative, and no media is asking any question about what's behind that. Moderna with the mRNA injection. Globally, we're seeing what's happening. People are waking up, and provincial government are still continuing with this nonsense.
So in 28, we had a level 4 lab in Winnipeg, right? Weaponizing influenza and playing with SARS-CoV and doing it all quietly on the hush-hush. And now Quebec is going to open one that just does it in public, plain view.
They don't hide it. Doug just mentioned that maybe it will be a condition for being hired for a job. And insurance. Imagine you're stuck in this loop. What Doug was mentioning, the loop where you are considered a mentally ill person. After that, how can you have a life insurance? Which company will insure you if you're in this loop? It can become very, very problematic for many people.
Well, I tell you what, if I was running an insurance company, and we're talking specifically about the mRNA COVID vaccines, I'd charge more for policies where people were vaccinated.
100%. Same as a smoker.
Same as a smoker, yeah.
Yeah.
The more vaccines you take, the higher your policy goes, the rates go. Right. One of the things, though, that Anna mentioned, which caught me a little bit by surprise, this whole Bill C-36 in BC, where the government is really trying to take over the administration of these professions. The underpinning logic of professional associations, and I was a member of the Association of Professional Engineers for years until I got sick of them, is that people with expertise are in a better position to regulate than those without expertise, right? And so that kind of makes sense on the surface. And so I thought Anna would be against this Bill C-36. And yet what she said during the interview there was that these physician-administered bodies, like the College of Physicians and Surgeons, don't work well as they are. Apparently, the whole administration and enforcement gets delegated to clerks who apply very narrow sets of criteria to disciplinary actions, like acting outside of your area of expertise. So you're an anesthesiologist and you render an opinion on psychiatry, and next thing you know, you get a reprimand. But this is all like a clerk function, and yet I don't see how government takeover is going to improve that at all. So this whole idea of professional associations and how they're regulated and how people are disciplined as a result is now an open question for me again. We do need some sort of mechanism to prevent doctors from raping their patients under anesthetic, and certain gross violations of the Hippocratic Oath and other things that they might engage on. Doctors are no more than people. There's good ones, bad ones. There's criminals. There's people that take pharma money from Purdue Pharmaceutical to push these drugs, on unsuspecting people and on false pretenses of how they're not going to be addictive, and it's all a bunch of hooey anyways. So there needs to be some sort of enforcement mechanism for these professions that have expertise. But I don't, if the existing structure with physician regulated bodies isn't working, and government getting into their foot in the door, and then making the criteria something along the lines of DEI, unless you read the DEI thing to your patients before you treat them, you're in violation of some government dictate or other. That's not working for me either. So I don't know what
we are in a certain form of bureaucracy, in the sense that I remember Dr. Sylwestrowicz, she was talking about the conversation she was having with social worker who have a kit of drugs, and they go around and they receive all those drugs, and they're not qualified to diagnose a mental illness, but they go and have those injections. And Dr. Sylwestrowicz, she was saying, I try to have conversation with them, with social worker, about side effect that are created by the drug, and they were not at the same level. And I remember I told Dr. Sylwestrowicz, I said, you lose your time talking to somebody who doesn't have your knowledge. And I think that's sometimes it's one problem we have. If a doctor is aware of the side effect, maybe he will be more cautious. But social worker, they're not educated for that. And she was referring also to policemen. Policemen were not educated or trained to recognize symptoms. And they were saying to Dr. Sylwestrowicz, it's after we talk to you that we start to understand that the mental illness of a person or the symptom are side effect of the injection. So you're there, you're saying to yourself, wait, the police who's supposed to arrest somebody who has a strange behavior are not aware of what is happening. They cannot recognize that. So there are discrepancies between the knowledge of the people, the skill of the people. It's quite shocking.
And that makes them not much more than paddy wagon drivers.
Exactly.
Well, one of the problems here that I see is that the diagnosis, prescribing, administering of these agents, which I think was readily described as being a dangerous drug, has now been pushed to the lowest possible level. So you have, pharmacists actually have some training, but these community social workers are doing this, running around on the payment on the payroll of pharma.
Yes,
it's down to the lowest level, and apparently there needs to be proper medical workup. There needs to be observation around side effects. all sorts of things that just aren't being done. And she also said, now you can buy this stuff online. I couldn't believe it. You can buy it online. Yeah. So I went online. I said, Abilify, for sale, right? And it came up with a generic version of it, and you can order it online. Well, that's just insane, right? If they have, the side effects that are claimed and they're dangerous, and there's lawsuits against them, and they're not even, there's warnings from both the FDA and Health Canada in lawsuits in the previous owners of these drug patents. These things cannot be described as being safe, or maybe even effective, when applied across a whole range of illnesses for which they're not indicated, maybe probably being used off-label. So the idea, of course, is to grow market share. And that's the internet's a good way of doing that. And I don't think it's good in people buying this stuff and taking it themselves. I mean,
one of you asked about the survivors, people who've gotten out of the system, and she said there aren't any; they're all dead.
Yeah, exactly.
So and I look at this from a business perspective, and I strip the morality out of it. Let's just look at it.
I see where you're going with this.
Right? A straight money game. I have access to a bottomless pit of low middle income and working class young men and women, or more into the seniors years, who I can very easily pull out of the system, turn into lifelong users until they have no more life. And nobody does anything because nobody thinks they can, or nobody wants to, or people just don't know that it's happening. But from a pure money perspective, that's a bottomless pit. That's
growing your market share.
Right. That's right. That's a hole in the market that will never be filled, and I can always pull money out of it. It costs human lives, but we all know that pharmacare is not really too concerned about that, because we know that they're in the business of keeping you sick.
Yeah. Well, they're not in it for the medical outcomes. No. As I said before, they're in it for the income.
Yeah.
Sorry. I'm not crazy. It was just a mosquito around me. There was something that you were talking about, Tim, about
your scheduled injection is knocking at your door.
Is there a knock on the door?
You were talking about patient.
Are you seeing things now?
Yes, I would say it's still here. I would say you said business model, and patient, I would say customer. Me, I have a question for Doug because Doug, you were referring to the Canada Health Act, and we are not aware that this act is very loose, and there's a lot of drugs that are approved by Health Canada, and we don't know them because we're not doctors, and we are confronted with those medication when we see a doctor. If the doctor prescribes me something, I take Centroid, which is for the thyroid, for a couple of years. I know about it. I know the effect. But for the rest, I'm not a doctor. So if the doctor tells me, according to your blood test, you have this, you should take that and that treatment, will I go on Google and start to see if the drug is authorized? It's just permitted, like, the mRNA, they were just authorized, they were not reviewed. So Doug, how a normal citizen can recognize this pattern through medication? Do we trust our general practitioner?
This is a very good question.
Can I tell a story? That's why I don't trust a general practitioner.
Of course.
I was diagnosed with bipolar disorder back in 2003 when I quit drinking. And so the first thing he does is, before a diagnosis, I go into the doctor with basically general depression, because I'm alcoholic and the bottom and finally fell out. Of course you're depressed, right? So he puts me onto citalopram, which is it's an antidepressant. And about 3 months later, my life's not really improving, but I haven't killed myself, so that's satisfactory. Send me to an actual psychiatrist this time. I sit in his chair for 2 hours, after which he gives me a prescription for another medication. And I said, "What is this?" He said, "You can check out. You can read more about it online. Did not tell me what it was or what it did or what its purpose. He said, this was a psychiatrist.
Maybe
You can read about it online, and you can bet your buns I did. So what was happening initially for me early in the no diagnosis yet, took 2 years to get a diagnosis. So this is just general depression, coming off of alcoholism, trying to stay dry and not do something really stupid. Put me on an antidepressant, and the antidepressant naturally increases your manic state. So then what they gave me was valproic acid, which is an anti-epileptic drug, whose purpose is for epileptics to help reduce the state of electrical agitation in the brain. So I'm going to go up, and they pushed it back down. And the result of doing both of those is you emotionally you move into a relatively flatline state. That's the end result. And I was compliant and non-compliant for many, many, many years. And eventually I quit the whole thing stone cold. And I was a year off of all the medication before I told a doctor, because I knew exactly what they would say. And even with the medication, I still spent time in institutions, even with the medication. So and this is all before this forced injection thing became part of, before I got onto that curve, that event horizon, so to speak. But even with standard oral medications, I was still moving deeper and deeper into that loop, to a point where as far as they were satisfied, I was stabilized. And if I'd gone any further, then the next options were very potentially what Peter Wood here in the comments has described. So the number of GPs that I could trust in the last 22 years are 2, and 1 psychiatrist who said no one is ever supposed to be on a psych medication for longer than 6 months. And he said, and you're supposed to wean you up to the maximum and wean you back down to 0, and then follow you at 0. So they create a baseline over time to determine whether you are or not actually presenting as they believe you are. So your GP and your psychiatrist actually have models where they can determine over time whether you are or are not exhibiting that particular behavior. But when someone comes in and goes immediately into an injection scenario, there is no opportunity for a baseline to be created.
Yeah.
Like Doug mentioned, if you weren't presenting before, you will be in about 12 hours.
It's a self-reinforcing loop.
That's right.
And basically what it does is extend these bad diagnoses.
Yes. Yeah, that's the goal.
And create, a continuing client for drug sales.
Yes.
Hey, get into the
customer, Doug.
Yeah, customer retention. It's a loyalty program.
Steady customers.
There you
the
go.
Loyalty program.
Yeah.
With a card that you can accumulate.
Well, you
Prime.
buy 4 injections, get the 5th one free. I don't know.
That's horrible.
Wait. That's important what you're mentioning, though, because Dr. Sylwestrowicz, she was referring to her new practice because she got out of the medical system, and she started to open up a new practice, with the Botox injection, for example. And she was referring to the pharmaceutical company who were selling her medication. And the more you buy, the cheaper it is.
Yes.
It's a business model. Yeah. So you can imagine a social worker who has those injections. The more they inject, the more they will have, and the more they will the lower it will cost. The lower it will cost. It's a business model.
Can you see the interview process with these people who are going to be delivering like circuit injectors, right? Running around circuit. So here's the interview process. Were you ever in Girl Guides? Well, actually, yes. Did you sell any cookies? I sold so many cookies. I was really good at it. I was the best person for selling cookies. You're hired.
Well, it's volume-based discounts. It's pretty common across all industries. It's not specific to pharmacy. I'd like to go back to this whole drug approval process, which was the question that Andre asked earlier. And it's going to take me a little bit of time to describe this, so bear with me. There's 2 things going on. There's the act, and I'll talk about not that thing there. No. Well, yeah, we could. so there's the act which is voted on in Parliament, right? Yeah, okay, this is good. So in the top right hand corner there, they lobby for drug approvals and fund studies and all that stuff. And so this approval process on the very right side, I've got off label in there because I just don't think that they have studies to support administering these particular antipsychotics across a whole range of things that show in the DSM. It's not possible to do that research properly, and substantiate why they're doing this. So I've got a called off label for that purpose only. But the federal government they pass acts, which are then enacted into law. So you got the Food and Drugs Act, right? And in that act, they delegate certain responsibilities to the people that write the regulations. So they can say that, the regulations can do this, that, or the other thing, or anything they want to, pursuant to the act. So you got two things at issue here. One is the act, and the other is the regulations that are written pursuant to the act, right? And the regulations never get voted on, and they're done kind of in secret, in Privy Council or elsewhere. And so I give you the example of the approval. Actually, not approval. It was authorization for Comirnaty, which was the first drug that was, authorized for use. It's a Pfizer product. It was authorized when David Lametti was the Attorney General of Canada. And it's in the regulation. And this was brought to my attention, and we worked on a report with our previous candidate for Burnaby North Seymour, who's a pretty accomplished legal researcher. And he looked at this regulation in detail, and it's kind of sequential, referential. You got to go from one section to the next. And at the end, Lametti, I'm sure, wrote this. It was authorized under a section of the regulations that refer to it as being for a drug that has not been sold in Canada for a sufficient period of time to be shown to be safe or effective. So they're authorizing the use of this Comirnaty, right, under a section of this regulation that says specifically that it's not known to be safe or effective. And yet they come out, Trudeau goes on TV and says, when I talk to your kids in private, please leave the room. You want to go and get vaccinated, talk to your parents to do it because it's the thing to do. It's safe and effective. And they said all this, right, in direct contradiction to the enabling regulation that claimed otherwise. The whole thing was a complete sham. It was a facade. And, I'm of the opinion that anybody that relied upon Trudeau's statement, right, of safe and effective, or anybody else for that matter, Theresa Tan or Bonnie Henry, anybody that relied upon these assertions of safety and effectiveness was subsequently vaccine injured should, and maybe they don't, but they should have, an action against these people individually for civil fraud. That's my opinion anyways.
Willful misrepresentation.
That's interesting what you're mentioning, Doug, because, suing the government is one thing. And after that, the government will, what's the word in English, will compensate victims, but with public money. And if we would be able to determine if there is a criminal intention behind that, because we understand that in a criminal trial, it's not the system that is accused, it's the person. And we have always this barrier or this safeguard for politicians to escape criminal accountability. I can refer to, Walkerton 2007, yes, with the water, with the E. coli bacteria. Yeah. The responsible was condemned to 7 years in jail. And it was not the institution, it was the person. So I think we have to be able to show, you were referring to David Lametti, the intention there, because there's no safeguard, is to harm people. It is not to cure them, because you see the number of prescription for antidepressant and drug injection are skyrocketing. So there's something, if their business model is to increase medication, there's an intention behind. Don't you think?
I do think. Yeah.
So how, for example, with the People's Parliament, how we would address this? Because with the recommendation, we can, like you said, pressure MPs and MLA. But if they feel that they are part of the problem, maybe they will not. They will not relay the recommendation.
Yeah. Well, it's a societal problem that needs to be addressed. The best way to do that, I'm not sure. I mean, Tim, yeah.
I think what Doug has done on this particular topic with People's Parliament is exemplary work. And as the first outing for the People's Parliament as a commission to do this kind of work, this again, I'll use the word again because it's true. It's exemplary work. The research that Doug has put into this and your support, Andre, for what you brought to this has given audiences something that, and I agree with what Doug says. This is supposed to be common knowledge. The average person can find this, but, and I'll use the other word again because I like repeating myself. You are synthesizing this into a form that is easy to digest and motivates the listener, right? So I think that as the People's Parliament moves forward and gets its running legs underneath, you're going to find a lot more engagement from the public, and there will be those in the public who will say, I can do that. I see what you're saying. I know where you're going. I have expertise in that. I want to be involved in this, And so I see this is going to be a growing activity.
Well, with this current example, we've got parents that apparently there's been 2 MLAs that lost their children on these drugs.
Right.
Killed them.
Yeah.
And so there's that aspect of it. There is a danger to the life of your children and yourself.
Yeah.
And then you've got issues around bodily autonomy, stripping informed consent without any evaluation of capacity. If you're compass mentis and you know what you want, and you're told that you have no more choice to decide what treatment you're going to take. If you're really a certified mental case, you're like just not even understanding what's going on, then I could see a court order saying, well, this person's not competent, then they have to become wards of the state or whatever, and they have to have informed consent or implied consent, pardon me. But if you're not like that, and they're telling you, well, sorry, you don't have the ability to deny this treatment because we stripped you of your ability to decline treatment and taken away your right of informed consent, right? Yeah. Then this is, a bodily autonomy issue. And then you've got, this sort of forced detainment or confinement or admission, on the basis of some nurse's, recommendation. And this is a liberty matter. So there's a number of things that are wrong with this. And I think between all of them, it should be possible to cobble together some sort of a pressure group of public opinion to make some changes. I mean, I'm not talking about radical things. Maybe involving the courts, maybe having, sunshine legislation or transparency around the relationship between pharma and doctors, a little bit more clarity around the way these pharma-funded and ghost-written, clinical studies, which really aren't even properly done, are presented to government. We'll see. But I mean, there's all kinds of ways we can interrupt this nonsense, and maybe make some basic recommendations for amending the legislation here in BC. But underneath all this, we have this underlying issue of corporatism. And it's not just pharma, it's the dairy lobby. It's anybody that gets a special treatment from government, and has an advantage, and then they kind of funnel some money back to their party of preference. And the whole thing is like money-driven preferential treatment at the expense of society in general. And that issue is, right now, it should be in the forefront of people's minds with pharma. There's all kinds of other examples. It's basically corruption. Influence peddling is the old term for it. Bribery, and it should still be a crime.
Yes.
Let's make bribery a crime again, right?
Yes. Yeah. Yeah.
Well, this is interesting, and you're mentioning something important, Doug. People who had bad experience with the law. Maybe that's the purpose of the People's Parliament. They are struggling with the law. They have experience. It's not necessarily an expert, but it's somebody who was in contact with the law, a bad law, and something that affected their life. Like you said, some parents or people, worker were fired, and they were struggling with the bureaucracy and the abuse of power. So the idea of the People's Parliament is to bring those people to help them identify the problem. Most of them, they have experience because they were caught in this system. I think Dr. Sylwestrowicz, she was caught in this system too because her own son was put in a mental hospital, and they had to fight with a lawyer. So she had the expertise, but she also had a bad experience. So I think what we could ask people is to come forward for the People's Parliament, and we will listen to you. We will see what is possible to do, maybe in a commission.
And do we have links for the People's Parliament to share with the audience?
Yes, we do. We do have the People's Parliament on X, so you can go there and you can follow the People's Parliament. There's also a YouTube channel, which is the People's Parliament, again with the first commission with Dr. Sylwestrowicz. And we also have another website that is in preparation. It's not ready yet, but if you are willing to participate as a subject matter expert or as somebody who had really hard experience with the law, whether it is provincial or federal, we advise you to come forward. It can be very, very interesting either for you and for us to listen to you. Doug, any comments? Mr. Bebb, we can see him on X too. So
I could say that language needs to mean something, And we notice that they've changed the definition. It used to be, like I said, the old terms were influence peddling on the part of government and bribery on the part of the recipient of special treatment. Now, what do they call it? Pay to play.
Yes.
Pay to play. Yes, exactly. Yes. Exactly.
Same thing, but a more sanitized reference.
Yeah.
Mr. Knight, you have any comment?
That was a great episode. I'm delighted. Yeah, and the audience is pleased and engaged as well. And we're hoping
we had quite a good number of viewers and good questions. So
yeah. So what I'm hoping is that the viewers that we're having here on the live and in the rebroadcast when you're watching on your own time, that you go to these links that you find at the People's Parl, PARL, on X, and also the same address on YouTube, and connect with Canada Defiant, which is Mr. Bebb on X as well, Andre Meloche, La Poète Russe on X as well, and keep in touch with them because at the moment they are the primary inquisition to explore these laws.
I just have one more thing to add, and that is that I found Dr. Anna Sylwestrowicz to be a very good witness, well worth listening to. And if you have the time, I would encourage you to go and watch the entirety of the interview because she was a gem, in my opinion.
She was, and I will also refer to Jason Dahl, who act as a moderator, but I think he's the chief of orchestra in a technician because he did the small clip, he created all the structure. That's the work of Jason Dahl, and of course Askari, who organized the first commission, and many more. You have Arthur Cleroux and Keith Tice who were participating. Tim, you were there. So I think it's important. We're trying to act politically and to make people aware of what is happening in their day-to-day life. And we are in a hard time now in Canada. So it was. I think we have more to say about not only the Mental Act but problems in general for Canadians.
Yeah, I think
Doug, go ahead, Tim.
Sorry. Just my final thoughts. I think what you're doing with the People's Parliament does indeed inform people, and I believe the work of the Commission and your reports will motivate people by giving them tools to do things themselves at a political level.
Doug, a final word. Thanks a lot for coming.
Oh, my
Cerberus
pleasure.
on the Improv.
Yeah, no, I'm happy to help where I can. Yeah.
Good. So, gentlemen, thank you a lot. And next week I will probably disappear. It will be Payment who will come back as a host. Thank you for watching. If you like the episode, just share it with your friends, and don't hesitate to come forward. The People's Parliament is for you. So that's it for today at Cerberus at the Improv, and we'll talk to you next week.
Thank you, Doug.
Gentlemen. Thank you, Doug.